And welcome, everybody. We're happy to have you join us for this webinar. This has been a series that we developed last year through the Native Center program under the umbrella of the Circle of Indigenous Empowerment. And that's what we're focused on, is empowering our people, our youth, as well as our work age folks and our elders. So we work with all age groups addressing various disability and cultural issues associated with those circumstances that each community has. As we know, Arizona has a wealth of different tribal nations and a diversity of Indian country, along with Phoenix, Tucson, and Flagstaff having many other urban Indians like myself as an Oglala Lakota growing up in Tempe, Arizona. So I was just at Mom's house for last week doing some work with our center. And so it's wonderful to be back working with my friends in Arizona, and nice to be able to start this program and hire Native people. We've already had some turnover, but a lot of that's great news because that, you know, with our youth, it's graduation and they go off and have other opportunities. And that's an example of empowerment that we're trying to, you know, focus on with this program. And so with the, under that umbrella or within our circle of programs is the Native Center that has these webinar series and other training opportunities. Finds Their Way, our youth transition that Josh will update for you before we get started, as well as partnerships with different, like Arizona YLF, our youth leadership forum. It's wonderful to have so many young people, skilled young people working with us, with our young ones. And we've presented with Arizona Aging Council so that we could update our folks, our elders with disabilities, with opportunities available and services available to support them. So it's a great honor to be here with you today. And thank you for joining us. Palamia Washtelo. And I'll turn it over to Josh so he can give a short update on the Finds Their Way, and then we'll get started with this very important webinar with our state liaisons and our support. And this is what we want to do in many states. Most of our states that have tribal liaisons, they have all of those state programs that they have to work with, and it's a very challenging job. But it's wonderful to have that Native voice and representation within our state government. So we really appreciate them and want to support them in any way we can through our disability services. So again, welcome and thank you for being with us. And Josh, if you could introduce the program and update, then we'll turn it over to our presenters. Lamia.
Oh. All right. Sio Nagad Kunji Stage Dagwadon Utan Junda Kwasti Dagi Listane. Hello, everyone. My name is Joshua Drywater, and I'm the program manager for Native Initiatives here at the University of Arizona's Sonoran Center for Excellence in Disabilities. This includes our Finds Their Way Communities and Native Youth Transition Program, which focuses on enhancing the access to resources and services for our Native communities. So I'm very excited about today's speakers because we have a cross-cultural collaborative and representation from some of the speakers today. So the Sonoran Center's Native Center for Disabilities webinar series examines the history of disability within Native communities, present-day challenges, and the possible solutions to creating a more equitable and accessible future for Native people with disabilities. In today's webinar, tribal liaisons for Arizona's Department of Economic Security will share services and resources available through multiple divisions, such as the Division of Developmental Disabilities, Division of Benefits and Medical Eligibility, Aging and Adult Services, and other community services. And also to note, there will be an opportunity for questions and answers at the end. Now I'd like to give a warm welcome and introduction to the DES Office of Tribal Relations Manager, Jocelyn Beard, to start the program off and introduce her team.
Thank you. Yes, Jocelyn Beard and Chef. The chief means look up but you see the ani that you say what the chief means that you know that what I was done. I say Chantal de Nasha. Good afternoon, I'm Jocelyn Beard. I am the Tribal Relations Manager for DES. and I oversee the Office of Tribal Relations for our department. And so I'm going to share my screen so we can get this rolling. Okay. Great. Okay, so as introduced, I'll be introducing my team in a little bit so that we can make sure that you know who they are and how to contact them from our department. So we appreciate the opportunity to talk about what we do here at DES through our Office of Tribal Relations, and we definitely offer that support. And as mentioned earlier, it's really good to have those that understand and know the ins and outs, the nuances of what we need to be aware of when we're working with our tribal members, our families, our partners, and especially our sovereign nations individually. So this is just kind of give you an overview of where we are in the department. Our office is out of the Office of the Director. We have a new director, Director Angie Rogers. And then in the Office of the Director, we have, we're also in nestled under the Office of Community Engagement. And you'll see there, myself here, Tribal Relations Manager, and we have many tribal liaisons available for our division. The Department of Economic Security is the second largest department within the state. And so we have 7 divisions along with the Arizona Intervention Program where one of our liaisons will be talking about. So there's a lot of programs and services. We have over 50 programs and services that we do provide out of our department. Oftentimes we get, oh, is that the food stamp department or the unemployment? It's like, yes, but we also do many, many more programs and services, which each of our my team members from a division will be covering today to give you a high overview. And I really encourage you all, if there's any specific division that you would like to have more information, a more in-depth presentation on, please definitely reach out to us and making sure that we get the information out. So the makeup of our office, here's all of our contact information. Again, I'm Jocelyn Beard. Next, after my presentation, we'll have Annette Ghazi, who is a tribal liaison for the Division of Developmental Disabilities, or DDD. Next will be Catherine Steffen. She's our tribal liaison for the Division of Benefits and Medical Eligibility. Patricia Sutton, she covers 2 divisions, which is the Division of Aging and Adult Services and also Community Assistance and Development. So she'll be covering 2 of those there. And lastly, and our new team member is Geraldine Antone Morton. She also covers 2 areas as well. She covers the Division of Childcare and also the Arizona Early Intervention Program, or also known as AZIP. We currently have a vacancy for the Division of Employment Rehabilitation Services, which we call DERS. We'll be posting that job announcements hopefully within the next week. So we'll be having that covered as well. We also have one more division, which will be hiring later in the fall for the Division of Child Support Services. Again, that we have 7 divisions along with AZIP. And so our department's pretty big. Our basic purpose for OTR, not only do we adhere and also support and in certain aspects enforce our DES tribal consultation policy. We have a policy within our division to make sure that when we're doing programming, when we're creating policy, we want to make sure the tribes are also involved. They're at the table to help us shape those things, because we want to make sure that we get their input and their feedback. Because one of the big things is our tribal members are also urban. They're in rural areas. They are like triple membership or citizenship. So those are some of the things that we want to make sure that we make sure they're included in some of the things that we do here at DES. So OTR addresses the needs of our tribal nations and assists on a variety of human services issues, providing guidance, assistance, suggestions on policy, education, and outreach with a specific focus on tribal government consultation and cultural awareness to DE's program staff, so we can focus on the strengths, needs, and opportunities for partnership and collaboration. We are the main point of contact for our 22 tribal nations, as you see here. One of the main things too, as a Office of Tribal Relations, we want to make sure that as we address and engage and communicate and partner and collaborate with our tribal nations, we don't use a cookie cutter approach, because each 22 tribal nation in the state of Arizona are unique, and that's true for all of the tribal nations throughout the country. Each are unique. We have our own culture, we have our own language, and to some extent, in Western terms, our own religion. So those are some of the things we want to make sure we take into account. So if we do something with Hualapai, I'm like, oh, it works there. We want to make sure that we, if we want to work with, let's say, Tanakan, and do the same thing, we got to consult with them and say, well, is this going to work for your community, for your members, and making sure that it's tailored to them as well. So we want to be cognizant and aware of those things, and teaching and creating that awareness internally with our DES staff and programs. We also want to make sure that as we work with our 22 sovereign nations, we educate the department that each of the 22 sovereign nations also have a different government structure. It can vary depending on their makeup, the way they process programs and requests and things like that. So we want to make sure that we also take those into consideration. And as mentioned earlier, there are rural and urban tribal members, both tribal members from the state of Arizona, but also tribal members from across the nation as well. So we want to be sure that when we're working with our tribal members, we are aware that certain, depending on where they are in the state, they may or may not have access to certain resources. How do we get the information to those in the rural areas, and also to those that are here in the city as well? So as our office communicates and creates those communication pieces for our tribal members, we want to make sure we're also aware of how do we get those messages out? How can we tailor it to where it's going to not only resonate, but teach them how to use our services here at DES. A little bit of statistics here. We have roughly, based on the 2010 census, we have roughly 353,000 American Indians that reside here in Arizona, which is around 7% of our Arizona population. So that's a lot. And based off of some of the data coming in, that number is definitely higher. Just with Navajo Nation alone, our population, it hovers around that same number. So making sure that our information that we do share, is going to be correct and current. And then also making sure that we as our DES staff, when we're talking and trying to collaborate with our tribal partners, to recognize too that they not only are they tribal citizens or tribal members of their respective nations, they're also still state citizens. So we need to provide services to them. And also they're also US citizens. So in a sense, we are, as tribal members, we have triple citizenship there. Along with our purpose for building our relationship with our 22 tribal nations, we have, again, as mentioned earlier, our 4 tribal liaisons currently who cover a specific division. It's definitely one of those big things is establishing our trust as a state agency or state government or just a non-tribal government in a sense. There's the mistrust there. So we want to make sure that we establish our trust and making sure that we are consistent with our messaging, consistent in making sure that we are checking in on our tribal partners and tribal governments for tribal consultation So that's very, it's very involved. It's time consuming, and building relationships with our tribal members is something we want to make sure we get it done not only right, but also in a respectful way. So in those ways, we try to have, we have tribal consultation, which provides meaningful dialogue between government to government entities, so that we can have the input, the comments, the suggestions between our state agency with the tribal government. We also conduct outreach that is culturally appropriate, ensuring that when we're reaching out, we're doing it in a way where it's not only respectful, but it's going to be efficient and effective for that tribal community. So we have regular tribal informational forums. We have them 6 times a year. Right now, they're all virtual, and the layout for the tribal informational forums are each of our division tribal liaisons will have a breakout session announcing updates, announcing any policy changes, any program changes, updates, so that the tribal members and tribal families or tribal staff are informed of our information from DES. We also created this year newsletters. So our first one was released for FY23 Q1, which was, I believe, in October, at the end of October. We'll be doing our fourth Q1 being released at the end of June. So we provide that information, and it's specific for tribal members and families so that they understand what's happening, getting links, getting announcements, so that they know it's something that they should be on their radar, because we want to make sure that the tribal members know, this information is for them, and it could be useful for their families, for their clients, for their program staff. So those are some of the things that we're doing as well. And also we do division presentations such as this. So I'm hoping as the tribal liaisons are providing their presentations, again, today will be very high level and just kind of giving that information. And as you feel a very strong interest in one division, please reach out to them and they can provide you a more in-depth presentation about some of the programming process and how to apply, things like that. So eligibility is always a big question, like how do I apply and am I eligible? What are those criteria? So those are the things we want to make sure that we're providing to our tribal communities as well. One of the other things too, because we're involved in the government to government process and relationship building, is we developed a training for tribal leaders. We train them and provide them information about what we do here at DES. And we inform them of what is the process for if they're tribal members going through an application process. What does that entail? We lay out some of the policies that we use in terms of utilizing those programs and what those entail, so they can give us feedback as well. We've done 3 of them so far, and we've got really good feedback from tribal leaders, and those were presidents and chairmen, vice chairmen, even tribal council were involved with some of their executive staff as well. So those were some really great ways to get that dialogue from them at the individual tribal level, making sure that we are including their specific information that they do want to be brought to the table.
Oh, Jocelyn, yeah. I'm so sorry to interrupt.
Sure.
We just got a question in the chat about the newsletter. Would it be possible to share a link to subscribe to the newsletter?
Yeah, definitely. In a little bit, I'll have my link to our website, and on our webpage for the OTR, it has everything on there. Links to all the newsletters, any of our past tribal consultations and things like that.
Fantastic, thank you.
Mm-hmm. Yeah. So again, building relationships, we are the point of contact for tribes. We want to make sure that that stays consistent and it's a reliable way for them to know, oh, I know I can reach out to Patricia for DOS or DCAD for those divisions. They have one person instead of trying to figure out, well, who's the right person? What's the phone number? they already know who to contact, and then she'll be able to link them to the most appropriate person in the division if there's a question or issue. So that's one thing that we are finding that's very helpful. And also we're, as we work in our area, we understand the protocols. We understand what should not be done, how things should be worked or addressed. So we're able to make those connections back and forth. So we're definitely that conduit between DES and the tribes, and vice versa, the tribes back to DES. And as mentioned before, working with tribes is very diverse. Each tribe is different and in their own right. And we don't want to make sure we create a process where it has a cookie cutter. We don't want to have a cookie cutter approach when we're working with tribes. So we want to make sure that each of their individual needs are met, depending, if they're in the southern or northern region or central. We want to make sure that those are individualized and say this is the tribal issue for this tribe, not for all tribes. So definitely want to make sure we point those out as well. And one of the big things that we do internally, because our team is fairly new, we are a resource for our DES staff. We're creating cultural appropriateness trainings within our department, and which has never been done. And so now we're able to create a way to educate our staff internally about not only what we do here at in Office of Tribal Relations for DES, but also how to work with tribes. Why is it so important to understand that the government to government relationship? We talk a little bit about the historical trauma. So those are some of those things as DES frontline workers or people working in policy or in business area. They understand the importance of getting a good understanding of what happens with tribes, what are the communities like, why are we making sure that we're involved in the conversation as our office works with each of the different tribes. So here's our website, and if you want to just Google it, just Google DES Office of Tribal Relations, and this link will pop up. And when you go to our office or our link, we'll have many links on there. It'll have our past newsletters, our announcements for tribal informational forums. It'll also have links to some of the reports that we've done, our contact information. And then also we have a new one where we have our tribal ombudsman piece. So there's a link there for requests for assistance, and anybody in the state who is having trouble, difficulty, or even a complaint about DES services, they can click there and put their information, and then we can get it and work with the person who's sending the complaint or issue or concern, and we'll make sure that we're addressing it in a timely fashion. So I really want to make sure that you guys are all aware of what we do. Our division tribal liaisons are your main point of contact for the divisions, and we want to make sure that you are and they are connected to tribal programs and partners. So please definitely utilize them. They also can facilitate meetings if you are interested in working with a program or a service area in our department. Reach out to them, and they'll make sure that a meeting is set up or is organized so that conversations can start on how to collaborate and partner. And also with working with tribes, we have definitely been identifying a lot of process improvement opportunities and making sure how we can not only streamline, but also provide better, not only customer service, but also services in general to those that might not be able to have access to DES programs, whether that be because they're in a rural area, they don't have the technology or the equipment, or even the know-how of how to navigate. So we're able to correct some of those things and making sure our tribal members are having ease in getting the services from DES. So that's the end of my presentation. I don't know if there's any questions yet, but we will be handing it off to Annette for her next piece. And I'll stop sharing.
Hi, everyone. Are you seeing my screen right now? Just a presentation?
Yes.
Yes.
Perfect. So my name is Annette Yazzie. I'm the DDD Tribal Liaison supporting the Division of Developmental Disabilities. And I also have my supervisor for DDD also on this call. So I just want to make sure that I introduce her. Her name is Barbara Piccone. Barbara, are you there?
I am here, Annette. Yes. Hello, everyone.
All right. So first, I'd like to point out our very important mission, which is the Division of Developmental Disabilities program empowers individuals with developmental disabilities to lead self-directed, healthy, and meaningful lives. And I want to make sure and point out right off about this program, the eligibility requirements in order for someone to qualify for the DDD program. They must meet several requirements, which are, for example, if you see here, they must be an Arizona resident. They must have lawful status in the United States, have proof of eligible qualifying diagnosis. And I'm going to mention more about that in the next few slides. And number 4, proof of at least 3 of the substantial functional limitations. So the Division of Developmental Disabilities program provides supports and services to individuals diagnosed with developmental disabilities like autism, cerebral palsy, epilepsy, cognitive and intellectual disability, and the most recent one that was added was Down syndrome. And there also, there's an exception for children who are under the age of 6 and at risk of having a developmental disability. So across the state, this program serves more than 50,000 Arizonans with developmental disabilities. Of those 50,000, you're probably wondering how many of those are tribal members. I have the answer for you real soon here, but I want to make sure and explain some of the other requirements in order to qualify for this program. In order to qualify, the disability must result in substantial functional limitations in 3 or more of these, what we call 7 major life areas. So I'm not going to read each of them, but I'm going to just read what we're looking for. So for the first one, we have self-care, receptive and expressive language, learning. The next slide, we have the remaining 7. We have mobility, self-direction, capacity for independent living, and economic self-sufficiency. If you see number 6 and 7 does have an asterisk, these apply to individuals who are over the age of 18. These individuals might have the capacity to earn their own living. So that's why they are provided with asterisks, just to explain that. I also want to make another exception here. If you can see here on the slide where it says note, at the top, we have the 5 disabilities pointed out, but for those children who are from birth to 6 years old, there is an eligibility is determined by one of the 5 qualifying diagnoses that I just mentioned above here. And or there's a strong demonstrated potential that the child has or will have one of the 5 qualifying diagnoses without early intervention services. And number 3, they have demonstrated a significant developmental delay in one or more areas of development. So here's a list of medical professionals that can make these very specific diagnoses. And each one, as you can see, are not. For example, for autism, a child neurologist with training in autism would be able to make the diagnosis. And at the bottom, as you can read there, it says Down syndrome. Only a licensed primary care physician or a clinical geneticist can make those diagnoses. So here's the overall breakdown of the 5 disabilities across the state over 51,000 DDD members. And as you can see, a majority of the population that we serve of DDD members have the primary diagnosis of autism. And they also have, right behind it, there's a cognitive disability. So here's a breakdown of the tribal members across the state. Again, breaking down the categories of the 5 disabilities. Here we have the largest population is the intellectual disability. Right after it is the at-risk category of those children between birth and 6 years old. And this statistic, or these numbers, are actually as of the end of April or last month. So the DDD program does have a redetermination process, and that happens prior to the age of 6 years old for DDD members, and again when they turn 18 years old. So the DDD application required documentation. We do need a signed DDD application, and there's a link here that you can click on once you get the presentation that will take you to the application that you can print out. And I'll explain how you can get those applications to us. Number 2, you will need to show a birth certificate, a U.S. passport, and for tribal members, a certificate of Indian blood. Number 3, if applicable, health insurance card, documentation showing the qualifying diagnosed disability. And number 5, showing legal responsibility. For example, if a if an individual has a guardianship set up, we'll need to see those documentation. So if you have the application already completed and you want to turn it in, there are several ways you can turn it in. You can email the application to DDDapply@Arizona.DES, or you can physically drop off the application at one of the 5 locations here. And if you can see also, Phoenix has 2 locations, and Flagstaff also has a location where you can drop off your documents. If you have questions before applying, you can also still email your questions to this email address, or if you prefer, you can call the DDD customer service line at this number here. So once a member is eligible for eligible for one of the DDD programs, what will happen is, I'm sorry, let me restate that. Once an individual qualifies for the DDD program, they'll be screened for referral to the Arizona Long-Term Care System. We just shortened that to ALTEX. And we also want to point out that DDD and ALTEX are 2 separate state agencies. So once an individual becomes a DDD member, they will fall in one of these 3 types of memberships. The difference between each of them, I just want to point out right away, is that if you look at the first membership for DDD only, this individual is not medically eligible for the All-Tex system and not financially eligible for the Access program. So they would be responsible for obtaining their own health insurance. And as you look in the second box here, this individual will be financially eligible for the Access program, but not medically eligible for the All-Tex program. And then the far left here is the long-term care DDD member. This DDD member will get the full scope of services, and this individual will qualify for, at the last bullet point here, they'll receive the long-term services and supports based on assessed need and medical necessity. So each, and also comparing the three, each of these memberships, the DDD member will get a support coordinator or case management. And the case management is responsible for setting up regular meetings, which, depending on what type of membership the DDD member is in, it might be for example, long-term care. It's going to be 90 days intervals. If they are DDD only, it will be 180 days each time they'll be visiting and talking to the individual during their person-centered service plans. So here's a list of some of the long-term service care services. For example, we have the respite, attendant care, and habilitation. And I'm not going to read each of them, but each of them has a description of what each one mean. The next screen here, we have a list of therapies that are available through the long-term service care, which are occupational, physical, and speech therapies. So the service coordinators will share with families information about some of these listed community-based organizations as resources to support the family. Some of the organizations, for example, is Raising Special Kids, Ability 360. These are all organizations that serve individuals with disabilities. So here at the Office of Individual and Family Affairs are also it's an advocacy agency that supports DDD members, for example, like the Behavioral Health Advocacy Department, or they have experienced individuals who will help DDD members navigate the behavioral health system. And to give you another example, here we have Justice Reach Enlisted. These are liaisons that assist in situations where DDD members might come in contact or interact with police and law enforcement, or are incarcerated, and they assist DDD members in making that smooth transition out of the detention center and back into the community. Here I have the DDD Customer Service Center line. Again, this phone number is available. You can call this number if you have questions about the DDD program before applying, and if you have any concerns, if you want to learn about any resources. For example, there are housing programs that are available for DDD members, and I'll tell you more about that real soon here. Oh, I apologize. That was the last slide, but the housing program is available. We have advocates that are available to talk to DDD members who might want to live in an apartment rather than a group home facility if they are able to live on their own. I want to make sure that I also welcome any presentations, opportunities for other agencies that are out there. If you feel or you serve members with disabilities or families, please reach out to me. Here's my email address. I'll be happy to set up a virtual presentation. And you can also contact, again, Jocelyn Beard is the supervisor here. And I just want to point out one more thing. Barb, did I miss anything here?
No, Annette, I think you did a great job. I just wanted to let everyone know that I did share some of our website information that will build on what Annette talked about today. So feel free, all of the websites are in the chat.
Well, thank you for your time, and I will now pass it on to the next tribal liaison. Thank you.
That would be Catherine Steffen with the Division of Benefits and Medical Eligibility.
You may have let me try this one more time. I apologize and thank you for your patience. Can everyone see my screen?
Yes, perfect. Thank you, Catherine.
You're welcome. Good afternoon, everyone. Thank you for joining us today. My name is Catherine Steffen. I am the DBME Tribal Liaison today, and I'll be sharing information about the programs and benefits provided by the division. As part of DES, you want to make a difference and connect families to the right programs and services they need. FAA completes eligibility determinations for nutrition assistance, formerly known as food stamps, cash assistance, a financial assistance program, and determines eligibility for certain access programs. Today, we will learn about all three programs.
Catherine, I'm so sorry to interrupt. It's just a little bit muffled. If you could speak up a little bit louder, please, that would be wonderful. Sorry about that.
I do apologize for that. The USDA establishes eligibility for the Supplemental Nutrition Assistance Program, SNAP. Interviews are required for nutrition assistance and can also be done by the phone. Next, we will discuss the nutrition assistance eligibility. The USDA calculates the Thrifty Food Plan using a mathematical model based on the cost of food, the nutrients in the food, nutrition guidance, and what Americans eat. The Thrifty Food Plan is intended to assist families in purchasing groceries needed to provide a healthy, budget-conscious diet. The food plan provides the maximum nutrition assistance benefit amount based on the number of eligible members included in the household, known as the budgetary unit. The plan is updated every year in October. And in addition, these amounts in this slide above are with zero income in the household. With income, depending on the rate of pay, gross wages earned, etc., these amounts could change. We have provided a link as a reference in the slide right here. The nutrition assistance resource limits are increased due to COLA. Starting in October 1st, 2022, the resource limit increases to $2,750. The resource limit for households which contain at least one participant age 60 or older, or a participant with a disability as defined by the nutrition assistance requirements. increases to $4,250. Maximum resource limits do not apply to most nutrition assistance budgetary units due to the categorical eligibility. The information is still recorded, however. These are the basic eligibility requirements to qualify for nutrition assistance here in Arizona. Arizona residency, identity, United States citizen, or qualified non-citizen. Income limits vary depending on the type of household. Resource limits vary depending on the type of household, ranging from $2,750 to $4,250. Certain applicants are exempt from the resource limit, such as those recipients receiving Social Security income. Many resources are excluded, such as vehicles and the home you live in. Documentation you may need. Here are examples of documentation that may be required, include, but are not limited to the following: identity, residency, citizenship, Social Security number, and income. There are secondary documents that can be used as verification, as proof of identity, and other documents. Please inquire with the benefit eligibility specialist team member. Potentially all the categories listed may be electronically verified. However, it is recommended to have these documents ready, as it may prevent delays in determining benefits. Now, shifting over to our cash assistance program. This program allows Arizona to provide cash assistance and supportive services to families and children. The purpose of cash assistance is to maintain and strengthen family life by providing financial assistance to needy dependent children. In addition, we have several tribes who administer their own TANF program, and that is Salt River Pima, San Carlos Apache, White Mountain Apache, Pascua Yaqui, and Navajo Nation. Supportive services are provided free of charge to help each participant overcome long or short-term dependence on benefits. Supportive services include the following: education, training and employment programs, as well as referrals for child care assistance. These are the basic eligibility requirements to qualify for cash assistance here in Arizona. Having a dependent child or children in the home, an Arizona residency, identity, United States citizen, or qualified non-citizen. Income, the resource limits do vary depending on the type of the household. Our last program is Access, Arizona's Medicaid program, made up of several categories that provide free or low-cost health care to qualifying persons and families. The goal is to reduce the number of uninsured and underinsured here in Arizona. FAA determines eligibility for the following categories: Medicaid eligibility, pregnant women, adult caretaker relative, children, kids care, and Medicare savings program. Income limits vary depending on the type of category, ranging from 100% of the federal poverty level to 200% of the federal poverty level most commonly. These are the basic eligibility requirements you must meet to qualify for medical assistance here in Arizona. Again, Arizona residency, identity, United States citizen, or qualified non-citizen. If the person is not a U.S. citizen or qualified immigrant, they may still be eligible for emergency services. Additionally, there is kids care that will not cost no more than $50 a month for one child, $70 a month when more than one child is in the household. American Indians and Alaskan Natives are not required to pay a premium or copayment. A person can only qualify for kids care if the person is not eligible 4 full services in any other access medical assistance category. American Indians and Alaska Natives who qualify for Kids Care may provide proof of tribal enrollment to be exempt from the monthly premium charges. Proof of enrollment or tribal membership includes certificate of degree of Indian blood, tribal ID, tribal census record, and other documents provided by the tribe stating that the person is an enrolled member of the tribe. When a person claiming to be an American Indian, Alaska Native, or the child, grandchild of a tribal member does not provide proof of tribal enrollment, the premium exemption does not apply and the premium may be charged. Eligibility is not denied because there is no proof of tribal enrollment. When a person is approved with a premium and later on provides proof of tribal enrollment, the person is exempt from paying the premium beginning the month after the proof is provided. What does access cover? A full range of medical services are provided, such as a managed care program and choice of health plans. Children may be eligible for dental services, but adults only in an emergency situation. For a full list of these items covered, please contact the specific health plan program. The number is located on the back of the insurance card. This slide provides information to our frequently asked questions. Each hyperlink highlighted in blue will take you to the page where you can explore and find more details about how to contact us, find a community assister, how to apply for our services, as well as finding a SNAP community partner near you. Next, we'll talk about our comprehensive service model. Our offices are open 8 a.m. to 5 p.m. This slide above provides the services offered in the field offices. A few reminders: an interview is required before DES can process your application for nutrition or cash assistance benefits. And you can help your application be processed faster by providing the required verification along with your application. How do you apply for benefits? Nutrition, cash, and medical assistance services are available virtually online and by phone. HEA Plus offers many advantages over the old paper application. Using HEA Plus, you can complete and submit your application for all programs, view and confirm receipt of your application online, upload documents directly to your account, and see your eligibility results online. Additionally, you can also log in or create a My Family Benefits account to view your case details such as approval notices, benefit amounts, and your certification periods, etc. With all of this information being shared, does anyone have any questions for me?
We'll take the questions in the chat and after.
Sure, thank you. If you have any questions in the future, please feel free to take my contact information listed on this slide, and I will be glad to assist you. Thank you all for affording me the opportunity to share information from the Division of Benefits and Medical Eligibility. Have a beautiful rest of your day.
Oh, Palamia, thank you so much to all of our presenters with DES and DDD and all of the services and supports that you do, not only for tribal members, but for all individuals in the state of Arizona. I know there were some questions regarding tribal enrollment, and generally you have, here's my tribal ID. So I'm a card-carrying Indian, as we call ourselves. But again, having the certificate or the ID, whatever the tribal nation has, is that proof of membership of the tribe. So some of our programs do require proof of membership, and then there's other programs that are just available to anybody that has a disability or the qualifying elements for these services. So a big thank you to all of you and the work that you do for Indian country, and we'd love to have your PowerPoint as part of our resources in our archives. And Lizzie, if we could add their website to our resource list that we'll post on our website so folks can go to their site to learn about the services they provide. That's something we want to do, is share the services that are available to all of our tribal members with disabilities. So thank you again for today. Any questions before we wrap up today?
And Jim, I think we actually have a couple of more presentations queued up, and still about 30 minutes here, so we have time.
I apologize. Good. Okay, more to come. So thank you so much. Any questions before we get to our next presentation regarding what we've heard so far? I know we had some more in the chat, but we'll get to those as we progress. So thank you so much again, everybody, and we'll continue. Thank you.
Can you see my slides? Is my slide up? I just want to verify.
Yes, looks great.
All right, thank you. Good afternoon. I am Patricia Sutton. I am of the Navajo, Cheyenne, and Arapaho descent. I am the tribal liaison for divisions of Aging and Adult Services and Community, the Division of Community Assistance and Development. First is the Division of Aging and Adult Services, DAS, which I will refer to as DAS throughout my presentation. DAS supports at-risk Arizonans to meet their basic needs and to live safely with dignity and independence. Services and programs support older Americans, older Arizonans, vulnerable adults, and refugees. DAS is comprised of 3 areas. First area is the Aging and Disability Services, ADS. The criteria for the ADS is an adult that is 60 years and older, or an adult over 18 with a disability and their caretakers. All the services that are provided for ADS is provided through our 8 area agencies. Which you see on the map. And it's, as you can see, there's only 6 area agencies that you can see. These are divided by counties. So if we have a tribal member that lives outside of tribal lands and is in one of these areas, and they will go to that specific AAA, which is the Area Agency on Aging. Here are the addresses, and I'll let you know that I have provided an electronic handout with all the web links that for all the various, for the information. I have a web link here for the AAAs and for all the various programs that I'm going to present on. So that will be provided to you by the facilitators. Arizona is very unique in which they have 2 AAAs that serve predominantly Native populations. First is the Region 7, which is the Navajo Nation Division of Aging and Long-Term Care Support. This AAA serves the entire Navajo Nation, which is in the states of Arizona, New Mexico, and Utah. Second, the last one is Region 8, which is the Intertribal Council of Arizona, and they serve the remaining 21 tribes in Arizona. The community-based, the AAAs provide the following services: home-based community-based services such as assistant care, adult daycare, long-term ombudsman program, the SHIP program, which is the state SHIP program, which is the State Health Insurance Assistance Program, Senior Medicaid Patrol, and Legal Services Assistance Program. Both Region 7 and Region 8 have opted out of providing legal assistance to the tribal members that they serve, because the tribes do have access to legal assistance within tribal lands. Next on with the APS is the Adult Protective Services. As you can see here, Adult Protective Services investigates allegations of abuse, neglect, self-neglect, and exploitation of vulnerable and incapacitated adults. As you can see here is the Arizona Revised Statute, the definitions for a vulnerable adult and an incapacitated person. Mind you, this only applies to state lands. Tribals have their own definition for a vulnerable adult and an incapacitated person. APS receives their reports via phone or online. Their central intake assesses these reports and decides whether it meets the criteria to be referred for an investigation. If it does not meet the criteria, which means it has to either fit the criteria here as a vulnerable adult or an incapacitated person, if it does not meet this criteria, then it's referred to as a referral for information. And they will provide that individual with resources to meet their needs at that time. Also, central intake will assess whether that incident occurred on tribal lands or on state lands. If it occurred within state lands, then they will refer it to the appropriate district, and that district manager will assign that to an investigator. If the report is for an incident that occurred on tribal lands, then that report will be cross-reported to the appropriate tribal agency that handles the Adult Protective Services, and if needed, to tribal law enforcement. The state also has 3 MOUs, which is a Memorandum of Understanding with 3 tribes. 3 tribes are Colorado Indian Tribe, Fort Mojave Indian Tribe, and the Salt River Pima Maricopa Indian Community. This is for the investigation of non-Native Americans who reside on tribal lands. Each of these Memorandum of Agreements, of Understandings, MOUs, define the process on how the investigation is to go. If our central intake unit receives one which a non-Native is residing on tribal lands, then it will assign it to an investigator who is within that region, and that investigator will reach out to the appropriate tribal agency and start coordinating the investigation. If we do receive a report for a non-Native American who resides within tribal areas that do not, there aren't one of the 3 tribes, then we will work with that tribe to make sure that an investigation is complete and follow up. And if it does get to where it's substantiated, in other words, the person is put on our list that they did, that the perpetrator did commit the abuse and neglect against a person, then they would be substantiated and put on a list. Last is our refugee resettlement program, which is the state's program with the statutory purpose of assisting refugees with effective resettlement through coordination of public and private resources that establish a path to achieving economic self-sufficiency as early as possible upon arrival in the United States. This really does not affect tribal people, but this is one of the programs within the division within DOS. And here again, for more information or to request a presentation, you can contact the Office of Tribal Relations or our manager, Ms. Jocelyn Beard, and myself. Here is my contact information. Let's see if I can get to my next screen. So I'm going to go ahead and stop sharing for a while and get to my next. Okay, my next division is DCAD. DCAD helps vulnerable Arizona meet their intermediate needs, transitional state housing, utility, and food needs, and create a path to sustainable economic independence. Most of this is they work through partnerships with other nonprofits or state governments to provide these assistance. And most of these can be assisted. Most of these can be also provided through the community action agencies. They have the housing security, which consists of the emergency rental program, the low income household water assistance program, the low income home energy assistance program. These are federally funded. These programs, you can submit an application online by downloading a written application or by phone. All this information, the web links and everything, all be provided again on the electronic handout that I have provided to our facilitators. Another one I like to also bring out is our safety, which is the domestic violence and sexual violence programs. There again, we partner with nonprofits to provide the information for advocacy counseling that is needed in those situations. One is an abuse in later life, which is for a senior who is over 60 that is in a domestic violence situation and lives in Maricopa County. And they provide emergency housing for up to 10 days. And for that, to access that, you must reach out to Region 1, AAA, and ask for the DOVES program. So I'm going to go ahead and leave it out. But like I said, all my on my electronic handout, I have links to all these various programs within it. And then you can investigate further. And if you need further assistance, feel free to reach out to me and I will be able to assist you. Thank you. And I'm going to go ahead and give it to Geraldine, who will finish out the program. Thank you.
Ja, ja, Geraldine Anton Morton Yenishe, Kia Ani Yenishle, Nakadana Busheshin, Zilka Daisha Destiny Daishanella. Hello, my name is Geraldine Anton Morton. I am the tribal liaison for the Division of Childcare in the Arizona Early Intervention Program. Adam, can anyone see my screen?
Yes.
Okay, thank you. So I'm working here. I'm going to present first for the Division of Childcare. And the Division of Childcare was created as a separate standalone division in DES in January of 2022 by uniting existing services and supports provided through the state's Child Care and Development Fund, what we will call the CCDF, in DES in collaboration with local health and human services organizations and community partners, and builds an integrated focus on childcare, early learning programs, cross-systems partnerships, strategic investments, and initiatives. The division consists of 6 administrations and works closely with other integrated teams in DES. The Division of Child Care Services as a lead agency for the Child Care and Development Block Grant. As you can see here, it was developed in 2014. When the Child Care and Development Block Grant Act was authorized in 2014, this bipartisan legislation was updated for the first time in nearly 20 years. The law made many important statutory changes focused on strengthening childcare to better support the success of both parents and children, while also providing a new emphasis on the importance of providing high-quality early education and care for our youngest learners. States enact this block grant through the final rule, also known as the Child Care and Development Fund, the CCDF. Its primary provisions require states to ensure equal access to safe, healthy, and high-quality childcare settings for working families and vulnerable children. Arizona's CCDF state plan is developed through a collaborative approach. The current state plan runs through 2024, and DES will begin developing the 2024 to 2026 state plan later this year. Child care assistance is available for families at or below 165% of the federal poverty level, the FPL, with children 12 years of age or younger. And this is for low-income working families, full or part-time employment, self-employment. These can also be applied to teen parents enrolled in high school, GED, ESOL, or remedial education programs, residents of homeless or domestic violence shelters, and individuals who are also unable to care for their children due to various events such as physical, mental, or emotional conditions, individuals who are unavailable to care for their children due to participation in court-ordered community service or participation in a drug treatment program. In all of these cases, a child care application is required and verification of income and activity are also going to be required. Child care assistance is available for other individuals and children in other circumstances without regard to income or for the following. If the family receives a referral for the Arizona Department of Child Safety or a Tribal Welfare Program, referrals from a DES jobs program, or they're receiving a DES cash assistant recipient, they will also can apply as well. If they have a grant diversion program for job search, and child care application is going to be required for this as well. TANF recipients who are employed must also have a child care application, and verification of employment will be required. Child care assistance is also available for grandparents and guardians when the following criteria are met. Only income received on behalf of the child is considered for child care assistance when the parent of the child is not living in the same home and when the parent or guardian is engaged in an eligible activity. Okay, so I'm going to talk about our DES Child Care Provider Network. Child care providers contract with DES to provide services to eligible children and families for financial reimbursement. Statewide, we have about 28,000 DHS or licensed certified child care providers, and about 50% of them are contracted to serve DES families. Average assistance and reimbursement to child care providers is approximately $950 per month per child. And nearly 30% of all children authorized for DES child care assistance are referred to by the Department of Child Safety. And we also have the ability, clients also have the ability to find childcare providers that are not affiliated with their families. And we have a process of helping clients and other families become childcare providers. And there are 3 different ways. We have the Certified Family Childcare Provider Plan, and this basically means that DES certified family care providers can provide care up to 4 children in their home at one time for compensation. We also have non-certified relative providers, and NCRP provides childcare services within the state of Arizona for members of their own family who are approved for DES childcare and are related by blood, marriage, or by court decree. DES contracted healthcare centers and childcare group homes. These are going to be DHS licensed center and certified group homes that will contract with DES and receive financial reimbursement for providing childcare to children eligible for DES childcare and assistance. So here we are, families receiving DES childcare assistance. They need to make sure that they choose a DES provider for their childcare. Arizona's Child Care Resource and Referral Program also helps families find best care options for their children by providing information for their child care search and decision, including having a searchable registry, state licensing rules and regulations, availability of child care assistance, and quality child care indicators. You can find more information on our Child Care and Resources Referral website, which is www.azccrr.com, or by calling 1-800-308-9000. Let's see. Participation in the Child Care and Development Fund, CCDF, allows tribal governments the opportunity to design, implement, and support programs which are beneficial to the unique needs of the tribal citizens. Through the CCDBG Act, American Indian and Alaska Native grantees receive no less than 2% of the discretionary CCDF funding and up to 2% of the mandatory CCDF funding. And in Arizona, there are 13 tribal CCDF grantees and lead agencies. We have the Cocopah Indian Tribe, Fort McDowell Yavapai Nation, Gila River Indian Community, the Hopi Tribe, Wallapai Tribal Council, the Navajo Nation, Pasquayaqui, Quechan, Salt River Pima Maricopa Indian Community, the San Carlos Apache Tribe, Tohono the Nation, the White Mountain Apache Tribe, and the Yavapai Apache Nation. And I have my contact listed here below, and I'm going to go into talking about AZIP. So AZIP is a service that is provided by our program and the Arizona Early Intervention Program. It's a statewide interagency system of services and supports for families and infants and toddlers from birth through 2 years of age. Usually these children will have some significant type of disability or delay. We partner with the Division of Developmental Disabilities, Division of Child Care, Department of Health Services, Department of Education, and other community agencies. And AZIP is established by Part C of the Individuals with Disabilities Education Act, IDEA, which provides eligible children and their families access to services to enhance the capacity of families and caregivers to support the child's development. And we currently serve up to 16,000 infants and toddlers yearly. So when we first start with a client with AZIP, we start with a referral, and the referrals goes through AZIP to begin the initial planning process. This planning process should not take longer than 45 days to complete, from referral to development to the individualized family service plan, which we will also call the IFSP plan. When a child is referred to AZIP, a service coordinator will be assigned to support the family and child throughout their journey with AZIP. The journey begins by gathering information about the child during the initial phone call and visit with the family. Other steps include the process of screening and evaluation, eligibility determination, and a child family assessment. As mentioned before, to be eligible for AZIP, a child must have at least a 50% developmental delay in one or more developmental domains, or an established condition, or based on an informed clinical opinion by a multidisciplinary evaluation team. Examples of an established condition are autism, cerebral palsy, Down syndrome, or other medical conditions that could impact a child's development. Informed clinical opinion is when a child is not showing 50% developmental delay, nor has an established condition or medical diagnosis, but the AZIP evaluation team has concerns about the child's development and are using their clinical opinion to determine eligibility of services. There are many IDEA Part C early intervention services an eligible child may receive, including and depending on the needs of the child and family. Some examples are going to be service coordination, developmental special instruction, speech, physical, occupational therapies, vision and hearing services, social work, and psychological services. AZIP has contractors and agreements with DES, AZIP contractors, Arizona State Schools for the Deaf and Blind, the Division of Developmental Disabilities to provide early intervention services. Not all children are eligible for AZIP, but there may be a support available through other programs. The service coordinator will provide information about other community services for families when a child is not eligible for AZIP services. And AZIP services will continue until a child is no longer eligible for AZIP or up until one day before a child turns 3 years of age. The service coordinator will support the family and the child to ensure a smooth transition out of AZIP into a program or agency that provides support and services to children 3 years or older. For example, a service coordinator may support a family with transitioning their child to Head Start, a private preschool, or a preschool within the local school district. For early intervention services for children aged birth to 3 years of age must have a significant delay in one or more developmental areas or an established condition that has a high probability of resulting in a developmental disability. AZIP is a separate department of the Division of Developmental Disabilities. It is a precursor to DDD. A developmental delay is met when a child has not reached 50% of the developmental milestones expected at their chronological age or more of the domains, and there are 5 domains. To make a referral for a child, contact the AZIP Central Referral Line, Raising Special Kids, toll free at 888-592-0140, or by email at azeip.info@raisingspecialkids.org. And let's see. And RSK can also be a referral agent for AZIP. Once a child has been made eligible for AZIP with the family's consent, DDD eligibility will be determined at a later date. So once the referral is made, within 45 days from the date of referral, the family can expect an initial call followed by an initial visit, and then it goes through the eligibility determination process. If a family is not eligible, referrals to other programs will be made, but if a family is eligible, assessment and creation of an individual family service plan will be made, and this covers outcomes and strategies and services based on the family's priorities and concerns, and there is no out-of-pocket costs for families. So one of our frequently asked questions is what types of services are available through AZIP if eligible. We have service coordination, we have developmental special instruction, occupational, physical, and speech therapy, and I have provided our contact information, the Arizona Department of Economic Security. The AZIP program is 1789 West Jefferson, and I've listed the phone number for the program is 602-532-9960, and you can also email the program at azip@azdes.gov. And you can also reach me, Geraldine Anton Morton, at jantonmorton@azdes.gov, and my cell number is also provided, 602-859-08 and 09. Thank you.
Oh, Palamia, thank you so much, Geraldine, and all of you for the information that you shared. And I want to make sure, Lizzie, is there any questions or comments that we can address before we close today from the chat?
I am not seeing any at this moment, but it's not too late. If you do have questions, please take a moment and go ahead and populate them into the chat. While we're waiting for those, I just want to, as always, make sure to say a special thank you to the Arizona Developmental Disabilities Planning Council. This webinar series is possible through the funding and support of the council. And of course, thank you to all of our speakers today.
Yes, a wealth of information, and thank you so much. You represent that full circle of services and supports, and having so many tribal members and your voice and representation is wonderful to have. We were very excited when you were able to provide us a webinar. So thank you for joining and sharing this information today. Any questions? You can raise hands if anyone has any questions. If not, we do archive and record these, and they'll be available on our website so that you can look at all those resources available for our youth and working age as well as elders. And oh yes, Lizzie did put a survey. Please provide a survey so that we can share with our funding agency so that we can continue this webinar series and the other resources that we can provide to our tribal members with disabilities. Any questions, any hands? A lot of information was shared in the chat. We'll make sure that's available as well for resources. And again, thank you so much for all the programs. Any closing messages from our presenters today?
I just want to say thank you for having us today for the Office of Tribal Relations, and please reach out to any one of us for a presentation. As you heard, this again was a high-level overview of what we do or what the division does, each division does here at DES, and they'd be happy to go over in depth about eligibility process, the application, any other questions, and we appreciate the time.
I believe someone else was wanting to share as well.
Say thank you so much for having us. We appreciate it.
Yes, and this is what we're all about, is working in partnership and building those resources and support for all of us. We can't do this alone, so the more information we share and work together, the better off our people are. And again, thanks for the protection for our elders, and many of our folks with disabilities are experiencing the abuse and neglect, and so thank you for that, as well as mentioning IDEA and the education supports. And again, we want to go with the full life experience from our young ones, working age, and elders in Indian country, and all of you represented that in a good way today. So Palamia for sharing. Any other closing comments before we stop our meeting today? Lizzie, did we address everything? Did I miss anything?
We sure did. Thank you so much. Thanks for joining, everyone. Have a great rest of your day.
All right, Palamia, thank you